Thank you very much. It's a pleasure to be here, and I appreciate your interest in learning the real facts, the real truth about health, and this specifically, during my presentation, the real truth about the massive venture to restructure the genetic core of the world's food supply. Now, I'd like to begin by asking you all to just imagine a certain set of circumstances. So let's just suppose the radical technology became developed through which novel forms of food could be produced. And let's further suppose that although this method was highly unnatural, its proponents were able to convince most people that it's essentially the same as producing new varieties of crops via natural breeding. Now, let's further suppose that the very first ingestible product that this technology churns out, let's say it's a food supplement. In fact, let's say it's a food supplement of an essential amino acid that we all need to live. Let's say that this food supplement, which ordinarily is quite safe, causes a major epidemic that kills dozens of Americans, seriously sickens thousands more, many of whom remain invalids for the rest of their lives. And let's postulate an additional fact. Let's suppose that researchers discover that the product contains a highly unusual mix of contaminants, at least one of which is deadly at extremely low concentrations, so low that most chemicals present at such a level would be completely harmless. And let's further imagine that the evidence as a whole strongly points to the new technology as the cause of that lethal contamination. Okay, now that we're going, let's suppose that now not just the first food supplement produced by this technology, but some years later, the very first whole food that it's able to produce and commercialize causes a troubling pattern of stomach lesions in the laboratory rats that are consigned to dine on it, and that in another group of such unfortunate rodents, 7 deaths occur within the very first 2 weeks, while only 1 death befalls each of the 3 comparative control groups that were spared consuming that novel product. And to further foul the picture, let's assume that the government scientists who review the test results conclude that they raise a safety issue that has not been satisfactorily resolved. And to make things even dicier, let's suppose that another division of government scientists who review a separate aspect of this product, completely separate from the issue of the stomach lesions and the unusual deaths, declare that that feature, that independent feature that they're examining, in itself poses a serious health hazard. Okay, now that we're warmed up, let's assume that a task force of government scientists thoroughly assesses this technology and concludes that it significantly differs from conventional modes of food production, that its products entail a unique set of risks, higher risks, and that each therefore must be subjected to rigorous safety testing before it is allowed on the market. Furthermore, why don't we make things even more ominous by imagining that the first food produced by this technology that is subjected to truly rigorous testing by independent experts who are free of industry influence yields very troubling results, and that because the study is of high quality, it gets published in a prestigious scientific journal. Okay, now that we're becoming bolder, let's suppose that many other well-conducted studies on the foods created by this technology detect significant adverse effects on the lab animals, and that one long-term study finds serious injury to the livers and kidneys, abnormal onset of large tumors, and increased mortality. Let's further envision that when independent scientists scrutinize the research that has been performed by the corporation producing the foods, they in several cases find that the data that was declared to support findings of safety actually raise serious doubts. And to make the plot even more sinister, let's suppose that in virtually every case of adverse results, there is good reason to think that the results have resulted from some aspect of that technology itself, and that similar deleterious disruptions could have occurred in other foods produced by it. So if such a technology actually did exist, and if all these suppositions we've just made about it were concrete realities, not just suppositions, how do you think society should deal with it? I assume that just about everybody would agree that the foods it creates should be banned, and that the enterprise that creates them should be promptly curtailed. And I doubt that anyone would consider that to be an extreme or unreasonable course of action. In fact, I think most people would suppose that in such circumstances, that particular policy would be fully justified. And just to be clear, that policy that would seem appropriate and necessary in almost everyone's eyes would not be to stick a label on these products, but to ban them. Well, as surprising as it may seem, and as unpalatable as it may seem, especially to people who have been trusting what our government, the United States government, and the scientific establishment have been telling them, such a technology does in fact exist, and every one of the suppositions I've just set forth is not a mere supposition, but a rock-solid reality. This technology, of course, is what is called genetic engineering, or by its proponents, genetic modification or genetic enhancement. It's technically referred to as recombinant DNA technology. And all those supposedly hypothetical situations have actually happened. They are concrete events that are unshakably linked to this technology. Let's go back and fill in some of the details now that we know that what I'm talking about actually has happened. It's not hypothesis at all. Okay, I think you've all heard ad infinitum, and probably to many of you ad nauseum, the claims that genetic engineering is just a simple, mild extension of traditional breeding practices that have been practiced from millennia. It's nothing different than Luther Burbank did, than George Washington Carver did. And in fact, it's far more precise, that's the claim, far more predictable, and that it's at least as safe as not safer. That's bunk, total baloney. Okay, now, it's very, very different. In fact, an eminent scientist who received a Nobel Prize, spent his career as a professor at Harvard, Dr. George Wald, stated in regard to genetic engineering that it represents the biggest break in nature that has occurred in human history. I'll repeat that. The biggest break in nature that has occurred in human history. Contrast that with the claims of seamless continuum that we are constantly subjected to. And Dr. Wald continued that genetic engineering should not be confused with any other intervention performed by human beings into the natural order, that it stood apart. It was dramatically distinct, and that's why he called it the biggest break. Also, an eminent molecular biologist, Dr. Lieb Cavalieri, who, by the way, in May of 1998, was selected by the American Association for the Advancement of Science to represent the perspective of science at a major forum it held on genetically engineered crops. There were three main speakers: Dr. Cavalieri, representing the perspective of science, a representative from Monsanto, representing the perspective of the industry, and then an executive with a public interest organization representing the viewpoint of consumers. So Dr. Cavalieri has some credibility. And he also speaks very boldly and straightforward, in a very straightforward manner, as he did that morning at that conference, where he basically stated that genetic engineering is very different, that its products cannot be presumed safe. And about 3 weeks later, he was back in Washington, D.C. at a press conference that the Alliance for Biointegrity hosted, announcing the lawsuit that had just been filed that day against the U.S. Food and Drug Administration, a lawsuit in which Dr. Cavalieri was one of the 9 eminent scientists who stood up as plaintiffs in that lawsuit. As was mentioned in the introduction, that was highly unprecedented for a group of eminent scientists to actually be suing a federal administrative agency on the grounds that one of its policies is scientifically unsound. Now remember, these individuals, these scientists, were not just scientific advisors, they weren't expert witnesses, they were plaintiffs in the lawsuit. They signed the complaint. That was unprecedented to have 9 such experts. And at that press conference, Dr. Cavalieri looked at the media, looked into the bank of cameras that were in the back, and he said, the scientists that have been claiming that genetic engineering is essentially the same as traditional breeding and just as safe are perpetrating a massive sham. That's the word he used. They were perpetrating a sham, and he said they should be ashamed of themselves, and they should be. And then he added, and you can quote me on that, unfortunately, I've looked at all of the newspaper articles and news reports that came out of that conference, not a single one quoted him on that. In fact, to my knowledge, I don't think any of them even noted that we had 9 scientists who were stating that the FDA's presumption that genetically engineered foods are safe, that presumption was scientifically unsound. That didn't get reported. What got reported was the propaganda coming from the grocery manufacturers of America in response to our suit, stating that we were trying to turn back the clock and we were basically trying to turn our backs on science. The whole reason that we had 9 scientists was to show that we were in line with science and we're trying to restore science. That's how bad the coverage is in the United States media. That's why the foods have permeated our market. I'll talk about that more later. There's an entire chapter in the book titled The Malfunction of the Mainstream American Media, Pliant Accomplices in Cover-Up and Fraud. And that title and subtitle, unfortunately, are not an exaggeration. I'll talk about that more later, but I want to skip ahead now. I want to keep going, and then I will develop that theme of the media and why the role it has played has been so fundamental, why it is a key accomplice in the disinformation. Okay, now what about that first ingestible product of genetic engineering, that food supplement? It was a supplement of the essential amino acid L-tryptophan, and L-tryptophan had been consumed regularly and in large quantities by hundreds of thousands of people, if not millions, in the United States, Europe, and other countries for years and years. And it was actually a very safe and effective alternative to drugs like Prozac and others, and because it helped people settle down and sleep without prescription drugs. That particular supplement that caused the epidemic was able to be traced back to one and only one of the manufacturers of L-tryptophan supplements, a Japanese company called Showa Denka. And it turned out that when further research was done, it was discovered that Showa Denka, several years before, had done something that none of the other manufacturers had done. In the interest of cranking out more L-tryptophan in a shorter amount of time, it had genetically engineered the bacteria that are used to synthesize the L-tryptophan. It had genetically engineered them. It had given them extra copies of the genes involved in the synthesis of L-tryptophan, and it had increased the production. But apparently, it also disrupted the metabolism of those bacteria, and it's known that genetic engineering can do that, that forcing living organisms to overproduce a protein that they, or an amino acid, any substance that they ordinarily produce, can create problems. And these bacteria do ordinarily produce L-tryptophan, but its production is highly regulated. It can't get above a certain level, and there are many checks and balances which were overridden through the genetic engineering. And again, the other side will claim that that genetic engineering has been completely absolved. That's total bunk as well. The evidence as a whole strongly points to the fact that genetic engineering was the cause. But even if we don't take it that far, in the FDA's files, I found in the 44,000 plus pages of documents that the lawsuit I initiated forced the FDA to turn over, I found a memo from the FDA's own biotechnology coordinator reporting on a meeting he had had when the Government Accounting Office questioned him about the L-tryptophan incident, whereas the FDA representative, when he reported on that incident to Congress, to a congressional subcommittee, didn't even mention the word genetic engineering and blamed it all on health food supplements, and the FDA used that epidemic as an excuse to take all L-tryptophan off the market, which, by the way, was a boon to the prescription drug industry because it eliminated a cheap alternative to prescription drugs. And the FDA had been trying to get rid of L-tryptophan off the market for years, by the way, and it had failed. And that epidemic gave it the excuse to do so. Never in public doesn't talk about genetic engineering, tries to get genetic engineering off the hook. But when the Government Accounting Office held the FDA's biotechnology coordinator to account, he had to admit that L-tryptophan could not be ruled out as the cause of that epidemic. So he admitted it couldn't be ruled out. And the evidence as a whole shows that it is far more likely than not that it was the cause. Okay, what about the first whole food produced by genetic engineering? Many of you have heard of that food. It was called the flavor saver tomato. And again, by the way, it's important to emphasize here that L-tryptophan supplement, as I noted, the bacteria were not what is called transgenic, at least in terms of the main genes that were given them to produce that substance. Those were extra copies of its own gene. Now, they were also at one point, to really crank it out higher, they were given a booster from another bacteria, I believe. It could have been a virus, but anyway, a different species. So in that sense, the latest version was transgenic to some extent. But the main gene, the main product being put out, was a product that it ordinarily produces. So it's very important to note that, and to note that the flavor saver tomato, the first whole food, was not transgenic in that sense either. It was just engineered in a way to turn off one of its own genes, to turn off the expression of one of its own genes. So this is important to bear in mind. Neither of these was producing an expression product from a foreign gene. So in other words, it implicates genetic engineering as a whole. It's wrong to focus on just the expression product of any foreign gene that is put in, because that could be a problem. But there is an underlying risk anytime an organism is transfigured through genetic engineering. And that's the important point. So getting back to the flavor saver tomato, it had just been engineered in a way to turn off the expression of one of its genes, which was supposed to allow it to withhold its flavor and not be soft in shipping and basically taste better and ripen more slowly, or to stave off the process that happens to soften it up. So basically, it was to allow this tomato to ripen on the vine and then be shipped and still be firm in the stores. It turned out being a commercial flop for several reasons, but that was the intention. But that company did something that it was not required to do at the time. It had a lab do testing on that, and the tests did show a curious pattern of stomach lesions to the rats that were eating the food in the experimental group. Now, when the FDA, then it submitted that data to the FDA. Now, the FDA's pathology branch, when they looked over the data, they said there is the pattern of stomach lesions raises, these are basically sores, erosions in the lining of the stomach. They raise a safety issue. They said to resolve this issue, we need to have more tests done. The company has to perform more tests. Now, this was the FDA's pathology branch, the head of the pathology branch, some of its top people speaking on behalf of the branch. There were other experts at the FDA who looked at that data and concurred that a safety issue was raised that was not fully resolved by the data, that more testing was required. What did the FDA administrators do? Well, by the time that had happened, they had decided that they didn't want to require any safety testing of any genetically engineered food, so they had come out with a presumption in May of 1992 that all genetically engineered foods can be regarded as safe, that none of them needs to be tested. So this information, this problematic information from their own pathology branch and other experts was coming to them in 93. They didn't like to hear that because that went completely against the presumption that they had issued in May of 1992. So basically, they did not require the manufacturer to do more testing. The manufacturer decided to stand pat. Why do more testing that could create disclose problems when you don't need to? What's more, so they didn't do any more testing. So the FDA bureaucrats declared that their scientists had reviewed the tomato, reviewed the data on the tomato, and concluded that it was safe, and therefore they said this tomato can be marketed. That was an outright lie. Oh, but there's more. Remember I said besides the stomach lesions, there was an independent issue involved with that tomato? Well, there was, because it's an issue that actually became shared by many other genetically engineered crops. See, to be able to select the few cells that survive the genetic engineering process and or successfully grow to adulthood and express can be transformed into a mature plant and express the trait that's desired, only a very small percentage of the cells that are subjected to the process actually are successfully transformed. So there has to be a marker that's that's added when the genes are put into that cell to allow the genetic engineers to identify it. And in this case, it was a marker conferring resistance to an antibiotic, because then you just douse all of the cells with the antibiotic, and only the few that were successfully transformed will resist the antibiotic and survive. So it's a quick and dirty way, cheap way of separating out the cells that were successfully transformed from those that weren't. The problem is, according to the Division of Anti-Infective Drugs that reviewed that issue from the FDA, that can be a serious health hazard. Introducing a gene for antibiotic resistance into foods that can get into the gut flora of the humans and the farmyard animals that are eating the foods, that could further spread antibiotic resistance. And I think you all know that's a major problem already. And because apparently these scientists knew that the FDA decision makers had a penchant, had a track record of ignoring warnings of the FDA scientists, they stated the conclusion in all capitals. I have a copy of that and many other memos from the FDA's files posted on the website of the Alliance for Biointegrity, www.biointegrity.org. All capitals. This is not a direct quote, it's a paraphrase. It would be a serious health hazard to introduce a gene coding for antibiotic resistance into the flora of the general human population. Okay, pretty strong language, huh? What did the FDA decision makers do? They ignored it. Oh, and they also lied about that too. They covered it up, and again, they claimed in public that their scientists had reviewed that and determined that that marker gene was safe, and so they approved. They gave that gene formal food additive approval, and they said it could be used in all future genetically engineered foods as well, and as I said, it was used in the majority of them. So that's how bad it can get. By the way, one of the FDA scientists wrote a very poignant memo in which he pointed out that there were other marker genes available. They didn't have to use the antibiotic resistant gene. He said it's just that those other genes will incur greater economic costs for the industry. It'll cost them more. It'll take more time. But he said we shouldn't let them use this cheaper one that's going to expose the public to a greater health risk. But of course, the FDA administrators sided with the industry's desire for the cheapest and dirtiest and most dangerous method rather than the safer, more less economically effective one. And they still could have put it out. But it's just the FDA sided completely with the needs of the industry, not with the needs of protecting public health and following the dictates of what their own scientists said was necessary from a scientific perspective. Okay, then I mentioned, we moved on, I said, assume that a task force of government scientists thoroughly assesses the technology and states that it can't be presumed safe. Well, I've alluded to that already. That happened actually before the flavor saver tomato. That happened back in around 1990, 1991, when the FDA was trying to formulate the policy it would make on genetically engineered foods. It assembled a biotechnology task force and took experts, scientific experts from the key divisions within the FDA that were relevant, whose perspective should have been consulted. And the evidence shows the memos that these scientists wrote to their superiors unequivocally demonstrate that the overwhelming consensus of the FDA's own scientific biotechnology task force was that, as I've said, genetic engineering is very different than traditional breeding. It entails different risks. The foods have to be carefully tested. Now, by the way, that's also what U.S. food safety law requires. I'll get back to that. But these scientists were speaking as scientists and saying from a scientific standpoint, these foods have to be tested. In fact, again, many of the key memos are posted on the Alliance for Biointegrity website. People don't have to take my word for this. You can see for yourselves. The memo that I numbered number 1 out of the 24 that are posted, I put it there because I think it's the key memo. It was written by an FDA compliance officer whose job it was to make sure that the agency was staying in compliance with the laws and its own regulations. She wrote a very strong memo to the FDA's biotechnology coordinator protesting, because she could see the way the policy was being developed, protesting that the FDA was trying to fit a square peg in a round hole by trying to force an ultimate conclusion that genetic engineering is the same as natural breeding. And then she stated, this is again is almost a direct quote, "The processes of genetic engineering and traditional breeding are different, and according to the technical experts in the agency, they lead to different risks." Okay, she didn't say there are some scientists in the, she said it's different, and according to the technical experts in the agency, it leads to different risks. That's a flat-out statement, and that's correct, because that was the overwhelming consensus among the FDA's own scientists. What did the FDA administrators do? I think you can guess it. They covered all of that up, and they lied in public. When the FDA released its formal policy statement on genetically engineered foods in May of 1992, it declared the agency is not aware of any information showing that foods produced by these new methods differ in any uniform or meaningful way from other foods. Does that sound like a true statement to you? No, of course not. It's an outright lie. coming from the agency that is entrusted, has the duty to protect the integrity and the safety of the food supply. It has the duty to stand up and protect you and me and the public. What did it do? It wanted to protect the interests of the industry. In fact, by the way, the FDA has admitted, not in that context, but it admitted, I think a few years after that in one of its own publications, that it has a policy to foster biotechnology. And it does. And in fact, the FDA and the other federal administrative agencies have had such a promotional policy since 1986, when it was promulgated by the presidency of Ronald Reagan. But that promotional policy has stayed in place through every successive administration, Democrat as well as Republican. So in fact, Bill Clinton pushed it at least as strong as Reagan and the first Bush had, if not stronger. And it appears that President Obama is pushing it just about as strongly, and in many ways perhaps even more strongly. So that is how bad it has been. An outright lie, fraud committed by the FDA, and they continue to get away with it. I'll talk about, well, actually maybe now's the time to talk about how one of the ways they continue to get away with it. By the way, so the FDA, let me backtrack just a bit, then I'll talk about that. Remember I said from a scientific standpoint, the FDA's own experts said these foods need to be tested. That was also what the law requires. That's what most people don't understand. They can't believe that because genetically engineered foods have been allowed to permeate the United States market, that our laws would have prevented that. They think our laws are weak. Most of you probably think that the EU, how many of you think that the European Union has stronger food safety laws when it comes to GMOs than the United States? Yeah, just about everybody. And that's a reasonable assumption given what's been happening. But the interesting reality is that the food safety laws of the US are probably the strictest in the world when it comes to GMOs too. Because according to the food safety laws of our country, of the United States, every one of these foods is supposed to be presumed unsafe until demonstrated safe. The burden of proof is on the industry to prove that every one of them is safe, and none of them should be on the market unless and until it has been demonstrated safe through standard scientific procedures. So not only has the FDA lied, it has broken the law, flagrantly broken the law. It knows what the law is, and it's been claiming that these foods can be on the market without any testing whatsoever. That is a flagrant violation of food safety law. My book, there's a whole chapter in the book explaining that, and it's one of the more chilling chapters of the book. In fact, probably, it's hard to pick a more chilling chapter in the book. It's very, very disappointing. More than disappointing, it's disgraceful, and it is criminal what the FDA has been doing. I don't know whether or not there are any technical criminal laws that have been violated. I have a feeling there are. But in using the word criminal in its broader sense of something really abominable that has been unconscionable, that has been perpetrated, definitely it's criminal if we're using that kind of definition of the term. And I do believe that some FDA officials probably will go to prison at some point for this, or be fined, because when the truth finally is out, there's going to be an accounting. There will have to be an accounting. So how did that happen, by the way? Now again, I was given, I and the attorneys working with me were given copies, 44,000 pages plus of the FDA's files during 1998. And in June of 1999, at a well-attended press conference in Washington, D.C., I released the key memos to the public, to the media. And that, as I said, there were representatives from major media at that press conference. That should have created a stir. In fact, observers in Europe, they contacted me when they heard about it. One guy said, fax me this. He said, if what you're saying is true, if this documentation is actually genuine, he said, genetically engineered foods are going to be basically, they'll be over in a few months. They can't survive. I thought that too. But what I that all rested on the assumption that the mainstream American media would report it. I mean, after all, it's one of the biggest governmental frauds ever committed in our country. Hundreds of millions of Americans daily had been ingesting foods containing these ingredients from genetically engineered ingredients without their knowledge. Most Americans for years didn't even know that they were consuming GMOs. They weren't labeled. And here, the government's own scientists who had studied it said these foods entail, higher risks. This is an amazing fraud. The public had a right to know about it. They didn't know about it. Most of the public, hardly anybody knows about it still. And I've been doing my darndest to get the word out. It gets consistently suppressed by the mainstream American media. And even when there have been investigative reporters, or in one case, a producer for one of the three main networks before cable TV became as hot as it has, wanted to do a story on it for the nightly news show. And I said, I won't spend the time to drive to the studio because I wasn't in a town at the time where there were any. I'm not going to take most of a day to do this unless you promise that what I read from the FDA memos will get out just as I read it. He said, you have my word, I want to report on this. That's what I did. None of that made it in the report. What made it in the report about science? Flack from the other side, propaganda from the biotechnology industry and the scientists that support it. So somebody higher up than even the producer of that program shut it down. There was an investigative reporter for the Washington Post. Remember, the Washington Post that thumps its chest about what it did in Watergate, its courage that it showed in Watergate. What did it do when given its investigative reporter did a major expose on this? The editor would not publish it, shut it down, edited it out, cut it out, so when that article was finally published, it was not what he intended. And again, there was no indication that there was any health concern from any legitimate scientist about the health risks of GMOs. And he had interviewed the scientists in our lawsuit as well. And he also wanted to put in quotes from the FDA memos, the FDA scientist memos. The Washington Post would not even publish that. So just recently when they had their whatever anniversary of Watergate, it kind of turned my stomach a bit because I thought, let's, when they start showing some courage and some integrity when it comes to reporting genetically engineered foods, then they deserve to thrust out their chest on what they did up on Watergate. But, it's amazing. It's amazing what has happened in the mainstream media in order to support the interests of the biotechnology industry and to keep the American public in the dark. And the reason that our market is permeated, even health food stores today are permeated with packaged and processed foods containing GMOs. Many people think they're safe if they shop at health food stores. They're not. A large percentage of the products there, and that are in their buffet lines when they have serve their own deli line, contain GMOs. The reason that you can go to a European fast food restaurant or convenience store and not find any GMOs is not because their laws are stronger, the food safety laws. It's because their law, whatever laws there are, actually their laws aren't being enforced strongly enough either. It's because the European media actually back in the 90s reported the concerns of independent scientists and reported research that was done that demonstrated significant harm to laboratory animals. And that created a wave of consumer rejection, and that meant that the big food chains said, we're not going to buy it, and that made the change in Europe. It wasn't the laws. It was really because the consumers became informed. The consumers became informed, and it's because the mainstream media in the United States and also Canada, unfortunately, have been suppressing the information that these foods have permeated the US and Canadian markets. That's the reason. Okay, I talked about the first food produced by genetic engineering that actually was subjected to really very rigorous, far more rigorous testing than the Flavor Savor tomato had. It was it was a genetically engineered potato, and it was subjected to a rigorous test protocol that was designed through funding from the Scottish government to develop a very rigorous way to assure the safety of genetically engineered foods. And the lead researcher actually assumed it was going to come out showing no problem, and that it would be used in subsequent GMOs, because he, like most scientists, thought it was going to be safe. So he wasn't trying to prove it was dangerous, and it was an extremely well-conducted study. In fact, the Scottish government conducted, I think Ministry of Agriculture, basically invited submissions for scientists and scientific research institutions throughout the world to come up with a very solid protocol for demonstrating the safety of genetically engineered foods. And that particular proposal won out over, I think, at least 40, quite a few. So it was very solid. What happened? Detected some very serious damage to the unfortunate rodents that had to eat those potatoes. And that study was published, has been published in the Lancet, which many of you know is one of the premier scientific journals in the world. Now, the other side attacks that study, has attacked Dr. Arpad Pushtai, who was the lead researcher, and his wife, who was also an eminent scientist and was on the team, attacked them. They were fired for no good reason, for only doing the good research, because he spoke out on a BBC program about the risks. That was his unpardonable sin. Also, he did the research too, and then had the gumption in their eyes to actually speak about it, because he wanted to protect the public. GMOs at that time were coming on to the UK market, and he knew they were on the US market. And he knew that that it would take many months, if not at least a year, before his research could get published. So he spoke, and he was castigated, he was fired, his reputation was destroyed, and then even with that, the Lancet published it. And the Lancet put on more referees than usually are there because of the controversial nature. It had 6 referees, and 5 of them voted for publication. The only one who didn't seemed to be a proponent for genetically engineered foods. So 5 voted for it. Many people will still say, and in fact, the New Zealand Royal Commission on Genetic Modification states in its report that because he spoke out prematurely, it preempted peer review and it couldn't be published. What? It was published in the Lancet. And they even got that wrong. Many of the proponents of genetically engineered foods have put out such disinformation that even that commission was confused. They will say it wasn't published. Or if you force them to admit it was published, then they say, well, actually, the referees didn't say it should be published based on scientific merit, just on social interest. That's not true either. They voted it to be published based on scientific merit. I mean, there's no end of misrepresentations and disinformation that has been dispensed to try to hide the facts, to sully the reputations of scientists who have done research that demonstrates significant harm to laboratory animals. Unfortunately, Dr. Pushtai is not the only one who's been attacked. Scientists have had their reputation smeared, others have been fired, people have been denied tenure at universities. That's one reason that, unfortunately, probably the greater proportion of scientists that speak out about this already have tenure, and in many cases already emeritus professors. They're retired, so they can't destroy their careers, but they still get at them in any way that they can. And so, by the way, that protocol that was supposed to really be rigorous and everything, was it used on any other crops? No. The UK government shut that research down, and they fell back on much looser, scientifically unjustified protocol they had been using, because that protocol obviously was too rigorous. It showed something they didn't want to show, so it didn't get used. All that taxpayer money in the UK was wasted, because obviously the goal was not, in the eyes of the government, to develop a protocol that could detect problems in GMOs. As soon as it started detecting them, they didn't want to use it. That's how bad it is. That's so again, we're dealing with a massive, massive fraud. In fact, my book demonstrates that the aggregate disinformation that's been dispensed by the mainstream scientific establishment on behalf of the biotechnology industry and the products that it creates constitutes by far the biggest fraud in the history of science, bar none. And my book there's a chapter in the book that goes through the other major scientific frauds and shows that every one of them pales in comparison to the aggregate fraud been committed on behalf of genetically engineered foods. And when I say eminent institutions, I mean it. National Academy of Sciences here in the US, the UK's Royal Society, the American Association for the Advancement of Science, the American Medical Association. They have all been involved in spin doctoring at best and in many cases dispensing misinformation and often putting out reports that actually are logically flawed. In fact, my book demonstrates that a 2004 report that was put out by the National Academy of Sciences here in the United States that is lauded and looked at as the gold standard. Many people say, of course these foods are safe. Look at what the National Academy of Science concluded in the report it released in 2004. Well, I went through that report systematically. Before I went to law school, I majored at University of California, Berkeley in philosophy, got high honors. Then I went to Berkeley's law school, got high honors again. I know something about logic, and I also studied a lot of science. And I think what I did might have been the first systematic assessment of that report. And it's astounding. They ignore evidence, they misrepresent facts, and if you there's illogic in it, some ludicrous assumptions where they go from some premise to a conclusion with a logical leap that is astounding and completely unwarranted. As I mentioned, I believe in the book, if not, I should have. If the essential reasoning in that report had been in a philosophy paper in any course I took at Berkeley, the student who submitted it would have been lucky to have gotten a D. Would have been lucky to have passed. In fact, if you take the chart that they have trying to show that genetic engineering is not the most risky technique, if you take that chart and actually cure some of the illogic and some of the things that they paper over and make it consistent with the rest of the report, it demonstrates that genetic engineering is actually the most risky form of food production. So their own logic actually implicates genetic engineering as the most risky. But most people don't know that. So again, it's in the book, it's been demonstrated. That's why several scientists have been praising the book. It's very rigorous. As Dr. Schubert at the Salk Institute said, besides stating it was incisive, insightful, and truly outstanding, he commended it as well-reasoned and scientifically solid. And several other scientists have also commended it for being meticulously researched and very solid. I'm saying this because, again, what I'm saying sounds pretty astounding, and people will want to attack it. And again, it's not that I'm just talking off the top of my head. I've thoroughly researched it, thoroughly analyzed it, and I made sure that there were many well-qualified scientists reviewing it chapter by chapter, helping me to make sure that it was scientifically solid and logically tight. Well, I mentioned many other well-conducted studies on the foods created by genetic engineering have detected problems, and they have. I don't really need to go through that right now, I think, because I want to leave some time for questions. But the book goes through many of them, and my book doesn't even cite all of the ones that are there, because the book was long as it was, and I cited enough to make the case. There is more than enough evidence just cited in my book, just that I've discussed right now, to have demonstrated that the presumption that genetically engineered foods are generally as safe as other foods, and that the technology is as safe as conventional breeding, that is an assumption that has been refuted. It's been refuted. And remember, the burden of proof is on the other side, according to law in the United States, and according to the law, the purported law in the European Union, which is supposed to be upholding the precautionary principle, which again in this situation would say the other side has to demonstrate safety. But in neither the European Union nor in the United States has the other side been required to shoulder the kind of burden of proof that it actually should have in this situation. Even in the EU, they've let the regulators have let the manufacturers off with a very, very light burden that is not at all what is required from a scientific standpoint to demonstrate the safety of these foods. So I want to just get back to this issue of the fraud, because it has been an astounding level of fraud. As my book demonstrates, makes the case very strongly, this entire massive venture to reconfigure the genetic core of the world's food supply rests, although it purports to be very based in solid science, in actuality, it rests on a foundation of falsehood and fraud. And that means it's highly vulnerable. It's highly vulnerable. It is precariously perched on a flimsy foundation, a foundation, again, of falsehood and fraud. All that we need to topple this whole venture, to drive its foods from the market, to stop it, and to shift the resources into the kinds of agriculture that are needed, and I'll get back to that in a moment, is for enough people to learn the facts, enough people to learn the truth. We don't need more research. We don't need new laws. We just need new awareness. And if a few key people were to read my book, actually read it, it would be all over. If Barack or Michelle Obama were to read my book, they would realize how they have been hoodwinked by scientists in whom they had a right to trust. They'd realize, they're very intelligent people and they're lawyers. They would realize how the laws have been broken, seriously broken. And I think they would be astounded. As we know, Michelle Obama has an organic garden. She has been out there speaking about the need for consumers to become aware of health and making healthy choices in food. How could she read my book and not think, whoa, we have got to do something? So, or if Bill or Melinda Gates read the book, as you know, the Bill and Melinda Gates Foundation has been funding the development of genetically engineered crops for Africa and the third world, and he's one of the biggest boosters. There's an entire chapter in my book called Overlooked Lessons from Computer Science, the inescapable risks of altering complex information systems. And that chapter demonstrates that as bad as genetic engineering is from the standpoint of biological science, it's even worse, even more foolhardy, in fact, borderline insanity, when examined from the perspective of information science, of computer science and software engineering. I should talk about this just a few minutes, because it in itself is enough to drive these foods from the market for anybody that actually studies it and understands it. And again, I've developed that chapter in consultation with several professors of software engineering and people who have been performing software engineering in industry, professionals, and they attest it's a very solid chapter. Consider this. We have learned, we the human race has learned over the years through software engineering that even if if a man or woman, a programmer who has developed a program and knows all of the architecture of that system and all of its planned interactions, tries to make a very refined improvement to that system, and according to everything that he or she knows, based on the way the system was put together and designed, because he or she designed it, there should only be that one small change and no other interactions. That assumption is false. We have learned that when information systems reach a certain level of size and complexity, there is no such thing as a completely controlled revision. because the default presumption actually should be that some other unexpected disruption will occur somewhere in the system, because these systems become what is called nonlinear. You can't make a simple prediction. You make a little change here that's supposed to remain localized, it could create disruptions elsewhere throughout the system. And even though, to try to get away from this problem, increasingly, different components of these systems are insulated from one another to minimize the risk of unintended interactions. And that has cut down on the unintended interactions, but it cannot eliminate them. So in the case of an information system that is referred to as life critical, that means that human life could be imperiled if that information system malfunctions. Some examples: the guidance system for airliners. You can't afford to have bugs in those. An airliner can go down. An X-ray therapy machine. You can't afford, for a little bug in that, a lethal dose of X-ray can be delivered, and it has been, by the way, when there have been malfunctions to the software system. So government regulators, the industry standard and the government standard in the US and other industrialized nations is, in the case of life-critical systems, even the tiniest, most refined, most surgically precise, presumably surgically precise refinement, you have to put the entire system through extensive testing all over again. Not just the tests, most of the tests that were used initially to make sure it was safe, but a whole new battery of tests to make sure you haven't created unintended disruptions. Now, the genome of any organism is far bigger and far more complex and far less understood than any human-made software system. And yet, the biotechnicians are presuming that what they're doing is essentially safe and predictable and that they don't need to do extensive testing. Is that insanity compared to what we know about systems that are smaller, less complex, and far better known? It is crazy. And the irony is that, as I said, one of the biggest boosters of genetic engineering is none other than Bill Gates, one of the richest men in the world who made his fortune through software engineering, probably the most famous software engineer in the world, and he is pushing a technology that violates all the protocols of software engineering, or at least violates the key ones when it comes to safety. So, if he or his wife, and she's an intelligent programmer, they're both brilliant people, if they actually read the book, if somebody they respect said, you've got to read this book, and they did, maybe they would have a Paul on the road to Damascus experience. You know, major conversions have happened in history. And this wouldn't take as much. It wouldn't take any act of faith at all. It wouldn't take any divine revelation. It would just take focusing, reading the facts, and realizing the extent to which you have been misled by scientists in whom you had a right to believe. So it's that easy. In fact, I just want to emphasize, if President Obama were to read the book, no new laws, as I said, are required. The laws have been broken. All he would need to do is write an executive order to tell the FDA to admit that its presumption that genetically engineered foods are safe has been solidly rebutted, and to get its policy in line with the law. Just the mere writing of that executive order would be all that is needed to take these foods down. Consumers would no longer want it. There'd be a demand to take it off the market. By law, they would have to come off the market anyway. So it's that simple. And how could Congress fault him for an executive order that is telling the executive branch to stop violating the will of the legislative branch? It's a really interesting, it would be very simple to do. So I'm very optimistic. At some point, these foods are going to be stopped. And it's not a matter of if, it's a matter of when. So that is all that is needed, because fraud and deception at some point get uncovered and they get known. And it would be so simple in this case. So that is my hope. And as I said, the resources that are being glommed up have been taken by genetic engineering for decades if just a small percentage of that had been directed toward developing better, sustainable, safe, what is called agroecological methods, the world would be in a far better place. By the way, the claim, one last claim to refute, claim of the promoters of genetic engineering is that these foods are needed to solve the world's nutritional needs, that without them we cannot have enough foods that are suitable for climate change, and we can't feed the third world, that we need genetically engineered foods. That also is pure bunk, and in fact it's scientifically unsound because the evidence shows otherwise. There was a major study that was completed recently, sponsored by 4 United Nations agencies and the World Bank. About, I think, 400 scientists around the world participated. It's been endorsed by scores of governments, except the United States government, and its conclusion is genetic engineering isn't needed. It was studying the future of farming, and it concluded genetic engineering is not necessary. And when the director of that project was asked at a press conference, do you see a necessary role for genetic engineering in the future of farming? He said, the simple answer is no. And that is the simple answer. And as the UN Special Rapporteur on the Right to Food has written in several reports summarizing many studies, there have been many studies conducted in sub-Saharan Africa that have time and again demonstrated that simple agroecological techniques can outproduce any form of industrialized agriculture, even when enhanced with genetically engineered foods. They're just not needed. And experts who actually are not just propagandists for the industry, but who look at the data, know that. The evidence has shown that these small-scale farms are more productive than large-scale industrial operations, than the big monocultures. They are more productive acre for acre. And that's what is needed, not more money going down the avenue of genetically engineered foods, which are unacceptably risky and are only being propped up by disinformation. So I envision the world that I envision, and the world that I fully believe is coming soon, is a world in which there will not be any more GMOs, in which the integrity of science will be reclaimed. Scientists will behave like scientists. They will not try to suppress information. They will allow the open, free flow of information. And agriculture will again be done in line with nature in a safe and sustainable way, and the human race will be far better off for it. Thank you very much for your attention. Thank you.
Okay, thank you for your work. We all appreciate it as much as we're trying to feed our children and ourselves organic. I really just have a comment, kind of a question too. I know that when Obama was running for president, he said that he would mandate the labeling of foods that were GMO. And then when he became president in his very first term, he appointed a Monsanto employee to the FDA. So I guess that's my statement. My question is, do you really think that he doesn't know that they're bad for us?
I don't think that he knows.
Even though he eats all organic and they have an organic garden?
Well, I mean, you can be an advocate for organic food and still, because listen, there are eminent scientists that are arguing that genetic engineering is so natural that it should be included in organic. They're trying to get it included in the organic standards. So the scientists, there are organic, in fact, one of the main scientist that has been arguing this way wrote a book published by, I believe, Oxford University Press or Cambridge. I think it's Oxford University Press. Tomorrow's Table. Her husband she's a professor at the University of California, Davis, Pamela Ronald. Her husband runs the organic gardening project, the organic farming project at UC Davis. And he co-wrote the book with her, and they argue that tomorrow's table should include genetic engineering. They are proponents of organic agriculture, but they're also major proponents of genetic engineering, based on the claim that it's essentially natural, and that the foods it produces are at least as safe as conventional foods. Now that's had a great influence. So with people like that, if you're president and you're getting pressure, if there are scientists like that saying it, you're not a biologist, you tend to go with them and think, okay, I can be in favor of organic and in favor of genetic engineering. That's why by the way, my book shows where several statements of Pamela Ronalds that just are not in line with reason and or the facts, and yet she's highly influential. We need to get the disinformation shown up for what it is. There have been advisors for the State Department, for our government, that have been, they tend to be proponents of genetic engineering, and they give the party line. And they spew it as if it's sound science. So, no, I don't think Obama understands even that the food safety laws have been violated. Not every lawyer knows the food safety laws. He was a constitutional lawyer when he was at Chicago. I didn't know all the food safety laws till I started doing the research when I became concerned.
Instead of mandating GMO labeling like he said, he appointed a Monsanto employee to the FDA. So he was on the side of the people when he was, feeding us the lines so that people would vote for him. But then when he was elected, he appointed a Monsanto employee. It just seems a little crooked to me.
Oh, well, it's not good. I mean, we know that presidents come under the influence of the industry. But if you've got eminent scientists telling you that there's nothing to worry about, it makes it easier for you. You can rationalize it. If I still am kind of, what's the old song, cockeyed optimist. I believe that Barack and Michelle Obama, and I believe that Bill and Melinda Gates want to do good for the world. I think that they sincerely think they're doing good for the world and that GMOs will. But they're allowed to believe that because of all the disinformation that's been dispensed by scientists. Listen, people have a right to believe that the National Academy of Science is telling them the truth, don't they? And the UK Royal Society, and that eminent scientists with prestigious medals and awards are not lying to them or are not spin doctoring. And so if the economically and politically advantageous policy is also, you think, scientifically correct, then it's much easier for you to think that. If either of them, or Bill Clinton too, were to read my book, I think that their minds would be changed. I think that they would be. And then I expect that they would act accordingly. But that's because I remain optimistic in the ultimate good of human nature. And I have to keep believing that. Or I wouldn't have written the book if I didn't think it would have an effect. Yes?
Sir, I want to thank you for providing us with a fairly systematic methodological approach to giving us more clarity what some of the issues are. And I would be the first one in line to purchase your book, because I really appreciate what you have done today. Now, I go to medical...
Thank you, and I'll be here to sign them, I guess, afterwards.
Oh, yes,
if any of you want a signed copy.
I find myself in medical conventions, and it is astounding to see the representation that is present there that represents the bioengineering viewpoint. They're covering their bases very, very well and providing misinformation in different arenas. Now, here's my question. What do you think we can do? There is an organization called Center for Science in the Public Interest. They have the largest food-oriented, scientifically solid magazine in the world. The editor, the chief there is Michael Jacobson, MIT graduate. Is there a way that we could maybe tie into these kind of consumer advocate organizations to perhaps lift the awareness in the community?
Well, there is, and the organization you mentioned, unfortunately, up at least as my most recent knowledge is, has still been, what can I say? they seem to, they're getting better on GMOs, but I know back in the late 90s, early 2000, that organization was actually one of the organizations that was helping promote genetic engineering, by and large. Although they've been critical of some aspects of FDA policy, by and large the message that one would get is that there's no major food safety concern. I don't know the extent to which that might have changed recently. I would love to have a dialogue with them. I'd love to have them read the book and sit down with Michael Jacobson, because again, that organization has done a lot of very good things, and they brought consumer awareness up in many levels, and they've made many significant changes. I just think, again, it's a case in which they have been listening to scientists in whom they had a right to respect the opinion, and they have been misled. It's very easy to mislead people in this, because what's going on in genetic engineering, what's really happening, most people don't know about, and they can spin it and contort the facts, and they've done it. My book goes into how facts have been suppressed. Just basic facts of biology have actually been misrepresented even. And it's astounding. So it's hard to completely fault anybody who's not an expert, because there has been such disinformation out there. As I said, even the Royal Commission of New Zealand, a blue ribbon panel, their report on GMOs, on the health risks of it, it contains several significant misrepresentations. Where did they get that? They got it from people that they thought were telling them the truth, but we're not. So it's really a very sorry situation where things are that jumbled that it's very difficult to sort out fact from fiction. It really is amazing. And if you do read the book, you'll see that. It's a very, as Jane Goodall said, not only did she say it's one of the most important books of the last 50 years, she has stated it's one of the most chilling books she's ever read. It's chilling to see how science has been subverted, how the media, again, has engaged in the kind of self-censorship that one could have expected from Pravda in Stalinist Soviet Union, but not in the United States of America, which is supposed to be a free and open society with a free press to make sure that government fraud is exposed, not to be complicit in allowing government fraud to continue. So again, we need to stand up. People have to wake up. It's not just we need to get GMOs off the market. We need a major reform, because we have to understand how this all was allowed to happen. And that means major reforms are needed in science and in government, the way the FDA is run, and the media. So we're talking about, it's going to help start a major transformation of the way our society is going. And so when the facts about genetically engineered foods and the way in which this whole venture has been able to advance and gain traction is fully understood, it's going to be a wake-up call, and many people are going to demand thoroughgoing change. It's going to be exciting to see the kinds of transitions that occur. But I think that there will be major ones. Yes?
Aren't there laws presently in the Senate or the Congress that is requiring labeling on food products of the United States so the United States citizens can see GMO labeling in all products that are in grocery stores? Is there anything in legislature in any state that will pass a law like they tried to do in California until Monsanto came in and bought out enough advertising that defeated that labeling for California? Is there anything any state can pass marijuana laws?
I'm going to come close to you because my hearing's not good, and so I'm not picking you up enough. I want to make sure I hear what you're
Okay. If marijuana was passed in states across the union, and they passed it in individual states, why is it so hard to get GMO labeling on our food products in our grocery stores so the citizens of the United States can eat healthier?
It's been hard to get those ballot initiatives passed because of all of the money that the biotech industry and its supporters in the food industry have been pumping in to put out, deceptive ads. And it would have won in California, by the way. My book discusses this. I mentioned the American Association for the Advancement of Science has behaved very badly. One of the worst things they did occurred during the height of the campaign in California. The board of directors of the American Association for the Advancement of Science came out with a statement basically to advance genetic engineering, to state that labeling not only was not necessary, but would confuse people and would be wrong. And there were several misstatements of fact in that. I discuss it in my book. We know that the margin of victory in California was razor thin. I think it's almost sure that that statement from the AAAS alone swayed enough voters. In fact, we know initially a large majority of Californians who were polled said they were going to vote yes. And then when the vote came, enough of them had changed their minds. And I have a feeling that just that statement, false, that very misleading statement from the AAAS alone swayed enough voters in California to make a difference. And that was in addition to all of the television ads. And so again, because I'll bet a lot of very intelligent scientists read that and thought, oh, well, you know, I want to be on the side of science. So, by the way, I sent an email to the board, and I called up and spoke to a staff member and told them there were mistakes, they had to retract it, and I sent it. She said, send it to me. I sent it to her, and then she confirmed that she passed it on to the board, and then I sent the chairman of the board an email directly to her university email address. Never heard back from any of them. Certainly they never acknowledged they were wrong, because that's not what they want. They're not into playing by the rules of science, where if you make a mistake, you acknowledge it. They were into convincing people to vote no, and they won. I mean, they did it. So we're up against that kind of thing. But again, as I state, the labeling campaigns, my book discusses in its last chapter, these labeling campaigns have done a great service in educating Americans as to what genetically, that there are GMOs, that they permeated the food supply for years, that they and their family have been consuming them unknowingly. So it's done a major service. But my feeling is, and this is just mine, and many activists who've been fighting for labeling for a long time have become convinced, they told me, even before my book came out, that they want to now focus on banning them. But if a food is on, I have never been focused just on labeling, even though it could be certainly better to have labeling than not. If foods are on the market illegally and you put labels on them, or if I, as a lawyer who knows what I know, were just fight for labeling, that tacitly acknowledges they're on the market legally. Because if a food is on the market illegally, you don't label it, you take it off the market. Labels are to give extra information to foods that are legally on the market, okay? So I do not want to in any way give the impression that these foods are somehow on the market legally. They're not. They are on the market in stark violation of the Food, Drug, and Cosmetic Act. And people have to know that. And so it's my role to at least get that information out, because I'm about the only one who's saying that. So that's why I need to stick to that message. And I think that actually would be easier to get a ban than to get labeling in the different states. I think we got to get the knowledge out, but that's just me. And if you want to be fighting for labeling, keep doing it. You're doing good things. You're bringing up awareness. So I think anybody should just do whatever you want. Whatever you feel is the most effective way for you to be involved, do it. Anyway, I know my efforts have to just be to continue to bring out the facts, to get people to read the book, to give talks like this, to hope that influential people will hear it, either here in the audience live or who are going to watch it on live stream or on video later, that enough people of influence will be reading the book and using their influence to get other people of influence to read it, and eventually we'll have enough people who actually have clout and power to do something about this, and I think the change can be very dramatic. I think we can reach a critical mass of people who know enough about the facts that we can topple this very quickly. That's just me. Many people might disagree with me on that, and that's fine. The main thing is we've got to get the facts out there. The knowledge has to be out there. Okay. So I think it's time to wrap it up. I appreciate your attention, your questions, and just learn the facts, protect your family and your loved ones, and start making ripples. You all have networks. Start getting the word out even more strongly about the the unacceptable risks of GMOs and the need to take them off the market as soon as possible.